Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. In the last class, we are discussing about the Karna vyadhana samskara. The first part of the Karna vyadhana samskara we have already completed, and we were discussing about the complications of Karna vyadhana samskara when it is performed in an improper way. Okay, the local spread of infection which can lead to so many problems, and also the injury to the different types of siras we have seen in the last class. Now, there are some of the iatrogenic complications, that is Vaidyakrita complications may be there, which leads to certain complications after doing the Karna vyadhana samskara. So, we will see what is this Vaidyakrita complications of this Karna vyadhana samskara. This is a reference given in Kashyapa Samhita Sutrasthana Adhyaya 21st. Okay, so you can go through that. Now, the physician who is unaware or untrained in exact procedure of a Karna vyadhana should not perform the same, especially for Rajaputra, to the kids of the king or any other kids of rich and royal people. This is what is told by Kashyapa. Kashyapa says that when you are doing Karna vyadhana to a Rajaputras or VIP people, etc., then an untrained person should not do that. That means he says that it is always dangerous procedure in the hands of untrained person. Okay, and in the hands of an untrained person, this is very dangerous procedure because he can cause so many complications, and this complication directly affects the brain because from the mastoid area and middle ear area, the brain is very nearby and infection very fastly spread to the brain area, and it may lead to a lot of complications. So Kashyapa says that due to lack of knowledge, there may be amacheda. Amacheda refers to improper or incomplete cheda, or kuvyada. Kuvyada means piercing at a wrong place. Okay, so resulting in many complications, destroying the name and fame of the physicians. So he also names such vaidyas as kuvaidyas. That means those who are doing Karna vyadhana samskara or any other procedures in the medical field without knowing the exact skill and also expertization, so such vaidyas are called as kuvaidyas. So here also kuvaidyas can do this. So Kashyapa says that so you should not be a kuvaidya. So that means Karna vyadhana should be always done by a suvaidya, not kuvaidya. Okay, so he may be even subjected to face a legal action. When you are doing the same for the royal people or king people, he may be subjected to the legal action. So he is as he is treated in Rajaputra. This is what Kashyapa says. See, when you see Kashyapa always gives more importance for this Rajaputra, royal people and all those things. He says Raja Taila, he says Rajaputras, okay, like that. Under the social circumstances of those time, so he always give more preference for the royal people. He always says that when you are treating these royal people, be careful. Okay, so it is advised that only after getting expertise in all the perceptives of Karna vyadhana, like site of Karna vyadhana, method of Karna vyadhana, timings of Karna vyadhana, area of Karna vyadhana, and complications of Karna vyadhana, by knowing all these things, then only a physician should go for Karna vyadhana, especially for Rajaputra people or VIPs. Now, Shisho Harsha Pramartasya Dharma Kamartha Siddhaye. This is what is told by Kashyapa Samhita Sutrasthana Chuda Karma Adhyaya. Now, and there is one important thing is that if you see the Kashyapa Samhita Adhyaya, it starts with the Karna vyadhana samskara. Okay, this particular chapter. Okay, but at the end he says that Chuda Karma samskara. So, iti Chuda Karma samskara Adhyaya Sampurnam, like that he says. That means lot of portion is missing here. Okay, we get very few information regarding Karna vyadhana samskara in Kashyapa Samhita because it looks like a big chapter, a long chapter, including both Chuda Karma samskara and as well as Karna vyadhana samskara. But nowadays only few shlokas are available, unfortunately, and the chapter ends as Chuda Karma samskara. Okay. So in the beginning shlokas which is presently available in this chapter, they are suggested towards Karna vyadhana samskara. But in the end it is told that Chuda Karma samskara. Exactly what is the name of this chapter is also not available. Okay, but shlokas which are available in this chapter, they are suggested towards Karna vyadhana samskara. Probably after explaining the Karna vyadhana samskara, he has explained the Chuda Karma samskara in detail, and a single shloka of Chuda Karma samskara is not available, unfortunately. So anyway, so this is Shisho Harsha Prabartasya Dharmartha Siddhayehe. So an expert and skillful physician who is endowed with the skills to attain Dharma, Artha and Kama should perform Karna vyadhana. This is what is told by Kashyapa. In a comfortable child and a happy child, Harsha Yukta Shishu, it should be performed. Again, it says that samskara should be always performed in a normal baby, not in an abnormal baby. He says that Harsha Yukta Shishu, the child who is healthy, lovely, and also good looking, and also doing well. Okay, Harsha Yukta Shishu, happy looking. So in those babies only you have to go for Karna Vedana samskara, not in the diseased child. So this again proves that samskara should be performed only for a healthy child. Now let us come to the clinical understanding of Karna Vedana samskara in the present day scenario. So what are the importance of this Karna Vedana samskara in the present day scenario? How it is applicable to the present day setup? So that we will see. And what are the benefits? Now, the local inflammation which occurs after Karna Vedana samskara create a wound which may act as a buffering mechanism for the stimulation of the body immune system. This is one version which is given by many of the authors. If you look into while doing this inflammation, while doing the Karna Vedana, a wound is created, and that wound will going to help increase the immunity. This is told. Now here, this is actually may be true to some extent, because wound healing always initiate or stimulate the body immune system. Okay, if the immune system is good, then only the proper body wound healing is possible. So here also the wound, a small wound which is created, if it heals in time, that suggests that your immune system is okay, or you can rechecking your immune system. That may be one cause. Okay, one possibility. Second one is, this looks like a method of a pressure point pricking as followed by in the acupuncture method. Now when you are creating the hole and an ornament which is have some weight has been kept there, so it continuously give a pressure effect to that area, it may give some acupuncture like effects. These are all the predictions. Okay, nothing has been proved. Okay, it may give like a acupuncture like acupressure or acupuncture like effect. Now it is believed that stimulation of the ear lobule, that means pricking of the ear lobule, also stimulate the adrenal glands, in turn reduce the respiratory tract infection. This is somewhere it is present. This reference is present. Maybe it is the experience of our respected teachers. Okay, so who are respected learned people of Kaumarpatya. So according to their experience, I am telling that it may be that Karna Vedana samskara which is done, and a hole is created. In the hole we are putting some ornaments, so this helps to stimulate the adrenal glands. In terms, the sympathetic stimulation takes place, and that helps to cause the relaxation of the smooth muscles of the bronchus, and as a result the chance of this allergic asthmas or bronchial asthmas and repeated respiratory tract infections has been reduced. Again, this is a prediction, and this is based on the version of my teacher. Okay, our teachers. So this version has been also given. So even in the folklore practice, if you see in the village area, they very strongly believe that if you go for strong Karna Vedana samskara, then chance of a repeated respiratory tract infection is very less. Okay, of course, by research we cannot, so far we have not proved it, but it is observed, observational science. If you believe in observational science, it is observed that in the village area it is commonly seen. People believe that, and we can also appreciate that those who underwent the Karna Vedana samskara, they have comparatively less respiratory tract infection compared to the other who have not undergone the Karna Vedana samskara. Anyway, now even the Chinese people and Japanese people will also follow this method in a different understanding. If you see the Japanese people, Chinese people or Buddhist people, so they do compulsorily go for this Karna Vedana samskara. Okay, so as a site mentioned in the classics is refers to the base of the ear. But nowadays most of the time you go for the Karna Vedana samskara in the ear lobule. Okay, but the site which is mentioned in the classics is Madhyatoho Karnapitasya. Madhyato Karnapitasya refers to the base of the ear that it is present in the mastoid area. Okay, so it should not be in the tip of the ear lobule, rather it should be near the base of the ear. So this particular type of pricking will be done traditionally in some of the tribal areas. If you see the tribal area women, so they usually prick the rings at the base of the ear, a long round ring. They prick at the base of the ear. But nowadays we are doing it in the ear lobule. And that is for the abhushan ashram. But for the medical purpose, for the medical benefits, the site mentioned is madhyatoho karnapetasya. It is not in the ear lobule. So exact position of the natural orifice is also controversial. Okay, exactly the natural Daivakruta Chidra, where exactly it is present, whether it is present in the ear lobule or whether it is present in the Madhyato Karnapetasya, in the base of the ear, this is again controversial. Okay, we need to work more on that. Now, improper piercing may cause severe complications, which may be which may lead to the possibility of infection spreading to the adjacent CNS area very rapidly. Therefore, you should be very careful. Proper aseptic methods has to be followed, and expert physician has to do it. Okay, it's a very skillful procedure. While piercing the ear, usually the baby cries, and the vocabulary of the child can be indirectly tested. This is another possibility of testing the growth and development of the baby by using the Karna Vedana samskara. We know that this should be performed in the 7th, 8th or 9th month. So usually by this month, the child will develop the bisyllable, monosyllable and bisyllables. Mama, Papa. So this will start. And stranger anxiety will be also there. And now child avoid the strangers also during this time. Okay, or it may show different types of expressions. So now this procedure can be also used while piercing the ear lobule by a strange person like physician, etc. So child may start crying, and child may utter some of the monosyllable or bisyllable words like mama, papa, etc. Okay, so this indirectly is also test for the language function. Now, injury can precipitate the local lymph node involvement with the reactive lymphadenitis and thus stimulating the cell-mediated immunity. A wound which is created here, so locally it can stimulate the nearby lymph glands. Okay, so we have got cervical group of lymph glands, axillary group of lymph glands, and so many supraclavicular group of lymph glands, and posterior cervical, anterior cervical, etc. So, and submental, mandibular, etc. So because of this wound, there will be a reactionary lymphadenitis. So this may thus stimulate the cell-mediated immunity, and this may be also a test to check whether the cell-mediated immunity is properly developed or not. Okay, cell-mediated immunity is very important to prevent from the tuberculosis-like conditions also. So there also by giving BCG, we are inducing the cell-mediated immunity. So especially it has been told that to prevent the Graha Rogas. Okay, for the Graha Rogas, it is told that Karna Vedana samskara should be done. So it is effects on enhancing the immunity against the microorganisms has been predicted. So as it is told that Karna Vedana samskara will going to prevent the Graha Rogas, and we usually compare the Graha Rogas with the microorganisms, different types of microorganisms. So we can predict that Karna Vedana samskara probably going to help prevent the recurrent respiratory tract infections. Now, this is all about what is mentioned in the Karna Vedana samskara and its clinical understanding. So thank you very much for watching my channel, and don't forget to subscribe my channel, and also please give your valuable comments. So with this we conclude. Thank you very much. We will meet again with another topic.